We've got Dr Meredith Craigie with us now, the Dean of the Faculty of Pain Medicine. Thank you so much for joining us, Meredith.
My absolute pleasure.
Nice to see you again. I think it's been exactly 12 months since we spoke last time.
Yes, and time flies when you're having fun and being half terrified.
Yeah, definitely. What do you think of the ASM this year so far?
The ASM's been going really, really well. I've been really excited by our pain medicine speakers and the topics that they're sharing, and the relevance to anaesthesia practice as well as pain medicine practice. So it was really great to hear Associate Professor Chad Brummett presenting fibromyalgia, but that's the problem of central sensitisation, chronic widespread pain, as an important thing that anaesthetists should be thinking about when they're assessing patients for procedures and surgery. So hopefully there's some take-home messages from the pain medicine world for anaesthetists as well.
Yeah, we've spoken to a few people that have commented on that lecture specifically, so
yes.
Sounds like it's going well.
And we had our other international speaker, Dr Lawrence Poré, actually explaining spinal cord stimulators and the technology behind them, but also again trying to put that into some practical outcomes, real world context for us from the annual pain medicine symposium on Sunday. So international speakers are providing us with some really great insights from the research that they're doing in their particular areas. And I guess that helps feed in then to the work the faculty's doing around procedures in pain medicine, which has been really our major educational project for this last 12 months, starting off with the development of our position statement, and then this year we're continuing the work with our 3 working groups, working on setting the standards of practice, the actual resources for the training program, and then a CPD program for fellows to maintain their skills and perhaps maintain accreditation. So it's a busy space, and I think it's helping to legitimise to some extent, I think, procedural pain medicine in the eyes of many who have had doubts about it. So interesting times from a training perspective, and that might translate into some outward-facing training opportunities as well. But first of all, we need to maintain our training program as one of the best in the world, and of course our pain medicine specialists are amongst the best in the world, so we're very proud of them, particularly the ones who presented last night at the college ceremony. Yeah.
So if we look back at the last 12 months since we last spoke, it's been a very busy year for you, I'm sure.
It has been an incredibly busy year, and I must thank my colleagues in my pain unit back in Adelaide for all their support and allowing me to have the time out. It's always the team behind you who make all of this work. I just couldn't do it without them. So, I've just got to say thank you. Got another year of it yet.
So what are some of the highlights for you in that past 12 months?
Look, I think the highlights for me have been a spring meeting in Cairns last year, where we were able to join with local Aboriginal health leaders and hear some of the challenges they face, but also it gives us wonderful opportunities because it's an area we've not actually developed much at all. And with the advent of Dr Susie Lord joining our board, she has a very strong interest in that area. We're hoping to progress that even more. I'm very proud to say we have our first Australian Indigenous doctor joined the training program, and he's in my pain unit, which is very exciting. But we also have a Māori trainee in Australia. We already have Māori and Samoan pain specialists in New Zealand, so Australia's been a little bit on the catch-up in the Indigenous health area. But it's an area we need to do some more work in, and that is starting to happen. And I think wonderful Dr Roger Gook, the autumn medal winner from last night, is actually doing some wonderful work using essential pain medicine to train Aboriginal health workers and roll those programs out in Townsville, Darwin and in the Perth area. So that's been a great area. The other area I think that's been important has been in the use of opioids. And it's clearly been a huge concern for our community, our governments, healthcare practitioners, and also the Therapeutic Goods Administration. So there's been a number of things going on, the rescheduling of codeine early last year. Now we're looking at can we do something in the regulatory space around opioids. Safe Scripts has rolled out around Victoria now, so we'll look at how that changes practice, but does that actually change prescribing but not actually lead to better patient outcomes because we don't have the pain services available for them. So I think that's our next challenge, is to have a stronger voice around the advocacy for the pain services that we need to support that change in prescribing. But with that in mind, we've had two really excellent health economic reports published. The first one is the one the faculty commissioned in New Zealand, which Professor Ted Shipton, who's the chair of our New Zealand National Committee, has been using to advocate to government for better pain services in New Zealand, particularly for rural areas. In Australia, Pain Australia, of which we are a partner organisation, had commissioned a Deloitte's Access Economics report that updates the one from 2007 to today, and that's called the Cost of Pain in Australia report, and it was only launched 3 weeks ago, and already that has drawn funding from the federal government into rolling out consumer education programs and looking at translating funds into the rural area for better pain services as well. So lots of exciting things have been happening, and the ongoing activity around the advocacy space has been a really busy time, and it will continue to be as we try to change attitudes, improve knowledge in the community across the health sector, and of course keep building our faculty.
Yeah, definitely a very busy 12 months.
It's been busy, it certainly has, but it's exciting, exhilarating, but exhausting at the same time. So, yeah.
And what about looking ahead to the next 12 months? What are your main priorities?
Well, looking ahead, I think we'd like to build on our Indigenous health initiatives, and that's clearly going to be a long-term project. Our faculty is still fairly small in terms of resources, and fellows are able to do that. But we've been able to mobilise our fellows to do our business as usual, which is training and assessments, and in fact had 10% of them involved in the most recent round of long case assessment, which is truly amazing. ANZCA would be pretty pleased if they had that many of their fellows mobilised as well. We've got fellows working on the various working groups for the procedures, into other committees as well. So we actually have fantastic engagement from our fellows. I'm looking forward to continuing to work with them over this next year. We're also looking to the future of what structure will the faculty need, and that's both around our faculty board structure, but also our staffing structure and our relationships with ANZCA itself, Pain Australia, and our long-term partners in the Australian Pain Society. So strengthening relationships, looking outwards a bit further to building stronger relationships with the College of Surgeons and our other medical colleagues will also be an important part of what I'd like to do. But one thing I've really enjoyed that I've started doing for this year is touring the regions and engaging with our regional committees, finding out what they're doing, what's happening in their space, how can we help them. And I'm getting really good feedback about that. My task is how can I actually perhaps advocate for their areas or engage somebody in the faculty to do some other task for them and help them improve their local situation as well as just looking at the national stage. So there are lots of opportunities. It's trying to work out what the priorities are and how we can help, and keep enjoying the fellowship of my colleagues. It invigorates me and makes me keen to keep going.
Thank you so much, and enjoy the rest of your week here.
My pleasure. Thank you very much too.